impacts in reforming healthcare system. My name is Julie Jones and I'll be your instructor for this week. So of course we need to start off with the origin of the word informatics. The word informatics, defined by the Oxford Dictionary, is the science of processing data for storing and retrieval, information science. The origin of the word was first found in 1960 from the Russian word informatica. We'll take a look at the history of informatics, including the invention of the stethoscope, which was invented in 1816 by Dr. René Laennec, who rolled sheets of paper to listen to obese women. What might be the controversy with this new tool back in the 1800s? For one thing, surgeons were thought less than because they got their hands dirty because they did surgery. Also, it took the doctor away from the patient. Instead of him listening to the patient's heart with just his ear, which most doctors did, he used a rolled up sheet of paper. So it's similar as you think now, in which providers use computers on wheels to discuss the patient's health history or to write in the patient's chart. So let's talk about the history, including Hippocrates in the 5th century stated that patient's disease should be documented as to the course and the probable cause of the disease. During the Crimean War, Florence Nightingale documented the poor sanitations for the soldiers and ways to improve it. And then in 1940, the ENIAC was first introduced as the first generalized purpose computer. Showed in the bottom right-hand corner. It was huge. In the 1950s, it was first documented by Ledley and Lester, in which computers would be helpful in medical diagnosis, in which they could archive and process information more rapidly. In the 1960s, Medline, an electronic health record, was first established. Medline, which contains journal citation and abstracts from literature from around the world. EHR started emerging during the 1960s at academic medical centers and government health centers to improve patient care. And in 1970s was artificial intelligence and MUMPS. MUMPS, otherwise known as the Massachusetts General Hospital Utility Multi-Programming System, provided the first type of programming language with a built-in database, which is currently in use today. Some of you may use EPIC system, which is a type of electronic health record system which uses this in their programming of their software. And then, of course, in the 1980s, we can't forget Atari, Commodore, and Internet. Atari was one of my first gaming systems I used as a kid, and I loved it. 1990s was established mobile technology and Palm Pilots stood out. And in the 2000s, the Human Genome Project. Some of you may be familiar with the Institute of Medicine report. In 1999, Two Ears to Human was published, and this report revealed how a large number of deaths were due to medical errors. This report revealed how important it was for informatics and higher degrees of nurses to keep patients safe. This led to increasing informatics in the curriculum in nursing schools, increasing the number of faculty using and teaching about informatics, and increasing the number and researchers on the subject. As part of the American Recovery and Reinvestment Act in 2009, the Health Information Technology for Economic and Clinical High-Tech Act was signed by President Obama. This allocated $17 billion to stimulate the adoption of health IT system or electronic health record systems. Let's talk about informatics today. There are several informatics domains within healthcare informatics. This includes nursing informatics, in which the nursing profession holds the longest record for holding training in informatics and with core competencies within the field. Physicians have also been practicing in this domain but have not developed a core curriculum until more recently. With the adoption of CPOE, or computerized physician order entry, pharmacy informatics has also increased and developed a core curriculum. With so many different types of informatics, a new broader term emerged called Health Informatics. So I want to talk a little bit about the patient story and how does that relate to informatics. First of all, it relates because the clinical record communicates the story of the patient through data, words, images, and codes. It is very important for the record to show the patient's story without having to do an endless search. We need to present this data in such a way to support clinical decision making at the point of care. The first step in patient story are the concepts of data, information, knowledge, and wisdom. In 1986, Bloom described data as discrete entities that are described objectively without interpretation, information as data that are interpreted, organized, and structured, and knowledge as information that has been synthesized that interrelationships are identified and formalized. In 1986, Bloom grouped and classified computers into functions as to whether they specifically process data, information, or knowledge. In 1989, Judith Graves and Sheila Corcoran, using Bloom's model in their article, it made use of information model known as Data Information Knowledge Continuum. In the late 1989, Irene Gios and Ramona Nelson added wisdom to the continuum. Data and information is the know what, knowledge is the know how, understanding is the know why, and wisdom is using it. So if we look at data, data is discrete entities that are described objectively without interpretation. Data integrity refers to the whole, complete, correct, and consistent data. This can be compromised through human error, viruses, worms, and other bugs, hardware failures or crashes, transmission errors, and/or hackers entering the system. High-quality data is data that are relevant and accurate represents their corresponding concepts. Data are dirty when there are errors in the database, such as duplicate, incomplete, or outdated records. The data that we process into information must be of high quality and integrity to create meaning to inform our assessments and decision making. Information is data that are interpreted, organized, or structured. The quality of information is necessary for it to be valuable and meaningful. Characteristics of valuable quality information is accessibility, security, timeliness, accuracy, relevancy, completeness, flexibility, reliability, objectivity, utility, transparency, verifiability, and reproducibility. Knowledge is information that is synthesized to identify and formalize relationships. So as you see here, it's organized information into chapters, theories, conceptual framework, complex stories, or facts. And wisdom is the appropriate application of knowledge to the management and solution of human problem. So as we look at information architecture, it's the design of shared information environments, the organization of data information to support usability. Usability is crucial in the design, implementation, adoption, and use of clinical products. Good usability results in products that are effective, efficient, and satisfying to use. And as we bring this all together, as leaders, we need to validate the data, verify that all participants has the same information, that participants may have different knowledge, and ensure that wisdom is what is best for the patient and consumer, and that the patient's story is easily identified within the chart. The future of informatics. So, what will be the future? So, imagining the future with cars that can drive themselves is right around the corner. For me, I'm impressed that my car can have adaptive cruise control where it slows down based on the car in front of it slowing down. Technology will be faster and more improved. There'll be more genetic mapping, which will lead to better patient outcomes. I hope you enjoyed the first class and look forward to